time, I think we should close the meeting. We are already a little bit over time. So I would just say a few words at the end of this meeting. And I just want to review our primary objectives we had at the beginning of this meeting. I think our aim was to facilitate a discussion on HPV vaccination programs by inviting key stakeholders from low and middle income countries to engage and share their experiences with HPV vaccination programs. So we really wanted, and we will, and I hope we are creating a HPV community in the global South. And the aims were also to share experiences and lessons learned, to discuss evidence-based policy and program implementation in and across countries, to contribute to the research agenda, to accelerate progress in HPV vaccine introduction, access, program optimization, restoration, and sustainability. Also discuss new developments in the field and health models that can be integrated with HPV vaccination programs. Also to provide updated information on available data on HPV vaccine evaluation, including schedules, and to discuss the integration of HPV vaccination programs with adolescent health services. And I think we covered quite a lot of these initial objectives. So I would now give the word to my co-chair for some final statements.
Thank you very much. First of all, let me introduce myself. I don't belong to this exclusive HPV community. I've worked on many vaccines, but not HPV. But I am the chair of the HPV Council, not because I'm an expert in HPV Council, but it's just I've been around a long time. I've been involved with HIV, pneumococcal, rota, influenza, many vaccines. I have to tell you, I've been to many conferences. I've been in public health for more than 40 years. This has been one of the most stimulating conferences for me. It brought out the importance of cervical cancer and where it sits in the hierarchy of number of cancers we have. The exciting part is I'm actually very jealous of all of you. I have to work with a vaccine like rotavirus vaccine. With rotavirus vaccine, our efficacy is 60%. And then we have to deal with interception. And when I worked with influenza, we had to deal with Guillain-Barré syndrome. You don't have any of those, but you have a very big challenge because you don't have a system that's been well oiled through the EPI system and all that, where we can deliver vaccines to children. You are on a very new territory, but in this conference, I was very excited to see the enthusiasm of the groups here. And you saw that we never finished any session on time. And the first day went on till 7 o'clock and the room was still full. And I've not seen that in many conferences, in the conferences that I've gone to. But I will just say that a quote from Stan Plotkins, who said, vaccines do not protect children, immunization protects children. Our challenge is to make sure we make sure every child is immunized. This whole thing about making it 1 dose versus 2 dose, I think it's a great thing, but the complexity it brings into this whole thing is just, it's mind-boggling to think what you all have to do to deal with the communication angle of these things. Telling one family, a family who's already received 2 doses, another family next door says, but you only get 1 dose. And how do you explain that to them? When just a few years ago, we told them, you need 3 doses. And then we said, okay, we can give you 2 doses. You're still fine. Now we say, we'll give you 1 dose. You'll be fine. So maybe I don't need a vaccine. I'll still be fine. So it's a very difficult communication issue. I really don't want to keep you all late, but I do want to, you need to bring all stakeholders together. I know we're all very enthusiastic. Everybody in this room wants to move on with it. We want to get on with it. We want to give vaccines to kids. There's a famous basketball coach who's called Wooden. Anybody heard of him? He made a very famous statement. He has the track record for having his team win so many matches. He said to his players, you must be quick, but you must not hurry. And I'm telling you, that's the lesson we as professionals have to learn. I made that mistake. I want to get on with it. And I finished the hip vaccine trial, and it was a tremendous success. I wanted to introduce it. I barged in, went to many ministries of health. It was a stupid thing to do. You have to think back and see what are the logistics of this. How am I going to do this? Several people brought up the issue of 2 doses. You have all your posters with 2 doses. And all of a sudden people are coming to this clinic and you say, no, you only need one dose. So I would just ask you, first, congratulate you all on what you're doing. You've done a tremendous job. I was very impressed with all the presentations. And then I'll end with one last quote. It's actually, I see several Gates Foundation colleagues here. If you go to the museum on the side of the Gates Foundation, there's a very famous quote that says, if you want to go fast, go alone. If you want to go far, go with the community. So you need to go with all the stakeholders. You can't run alone because you'll go far, but you'll be going alone. Nobody else will be there. So best of luck to all of you. And I want to congratulate you on what you've done, but this is just the first step. A big hill to climb, but I do believe because of the enthusiasm and all the hard work you're doing, 2030, I think you are going to reach your goals, and the best of luck. Thank you.
Thank you very much, Madhu. And before closing, I think we cannot close this meeting before thanking a number of people who made this possible. First of all, I want to thank the SPC members and especially those who actively participated in this meeting. Nelly Mungo, Margaret Stanley, Edina Amfosa da Costa, Mario Poljak, Dr. Joe F. Bay, Her Excellency Zainab, from Ghana, Kwame Afonso Ashiano, and also Deborah Watson-Jones, and also all our SPC members who helped to figure out this program. I think also this could not have been happened without the excellent team I have the pleasure to lead. So big applause, I think, for Nayab, Ricardo, Brenda, and Xenia. I think also the team from Travelogic with Jermaine and Romain did an excellent job. So thank you very much. And also the technical team and the hotel team. I think it was really very nice support and everything went very smoothly. I also want to thank our partners, Johns Hopkins University, GPEGO, especially Sarah. She also put a lot of energy in getting this program together. And the London School of Hygiene and Tropical Medicine. Of course, also our co-hosts, the Ministry of Health of Ethiopia and ISOG, they also did an enormous job to make this happen. Of course, also, we want to thank the Gates Foundation for supporting this initiative. And I think finally, all the shares and all the participants, because this was really what made this happen. We just facilitated. So again, as I learned from Nelly, a big applause for yourself. Thank you very much. Before closing this meeting, finally, there's just one. We will send out an email with a questionnaire. So we would appreciate very much. It's already sent out. I thank you, Ricardo. It's just 4 to 5 minutes and to respond what you experienced. And if you have any suggestions for the future, it's an online tool, so it won't take long. So appreciate if you fill it in. So, and before finally closing the meeting, there's one final announcement.
Thank you. And just to echo the thanks and to congratulate the University of Antwerp and London School colleagues on the Chic Symposium leadership here. I think it's great. And so tomorrow there is a satellite meeting hosted by the Chic HPV Council, of which Professor Matu is the chair. That's many of the people in this room, but a smaller group, so we're meeting just in that part of the room. And very important to note, the meeting is starting at 8 a.m. not 9 a.m. But we will finish early, probably possibly 2:30, maybe certainly by 3, because of the festival celebrations that will be starting tomorrow afternoon. So earlier start, but earlier start, but also earlier finish. Thank you. Sorry to interrupt your closing.
No, I just want to say travel safe and hope to see you soon at the next occasion. Thank you very much.